Hi, everyone. Welcome back to the podcast. I'll welcome all new listeners and welcome back to those who've heard my content in the past. If you want to know why barbell athletes are different, you need to tune into this episode. Before I go on to the podcast, what is new? What's better in life? My kids are doing fantastic. My son Zach is questioning my logic every single day. My son Jacob, who's 2, his vocabulary is growing exponentially. And my daughter is very much into dancing and gymnastics at the moment. So that's been fun. But other than that, I'm looking forward to a good weekend away with my family. I always enjoy those. Other than that, life is great. Onto this podcast. Okay. Why are we talking about barbell athletes and why are they different? In this episode, I'm going to outline why you should approach these athletes different, because they're not like tennis players, they're not like soccer players. They are different. And if you enjoy working with these individuals, or you've never worked with them and you want to be able to handle all types of athletes on your schedule, this episode is perfect for you. I'll also outline my history and how I've come to specialize in barbell athletes and what's important for you to know inside your clinical practice. And I'll give you a framework to easily approach these people with ease, and that way you can have a schedule full of either barbell athletes or athletes that you enjoy working with. Okay, all right. So let's talk about this. So, why are barbell athletes different, and what does that do to your schedule? What does that do to how you approach these individuals? So, I think the first thing you have to know is that barbell athletes are a different breed. They first and foremost, they don't want to stop, right? More so than any athlete that you can work with. I'll put that right up there with MMA athletes. These individuals don't want to stop, and they won't stop. They like a lot of load or volume or intensity. They just like it. They love it. They love being under a barbell. They love training, and they will find their way around it. And so, how does it impact you in your clinical practice? I think you have to understand that um, you can't approach them with your typical conservative approach of like, hey, yeah, let's just take a little break, or let's just see how it goes week to week. These people don't like that, and they won't last on your schedule. Meaning, if they don't buy into your service or what you're about to do for them, they'll just jump off. They just drop off. They don't come back. They won't continue. And I think you have about 3 or 4 visits before you find that out. And how did I come to specialize in these individuals? I used to, when I first started as a sports PT, I started out in working with rugby athletes. I worked with Olympic Training Center athletes. I worked with USA Track and Field and all these other things. And finally, when I went into clinical practice, I ended up starting at a CrossFit gym, and I too was doing CrossFit, and I started working with these athletes. And as I got to know powerlifting, Olympic lifting, and CrossFit, I saw that there was a different approach to these individuals because their mindset is different. And I noticed that they were looking for certain things in the providers that they were looking for. And now what I realized is that you didn't have to do CrossFit or Olympic lifting or powerlifting. You didn't have to, but the way you speak to them, the way you outline things was very, very critical. And as I saw more and more of them, I realized there was a huge need. And so that's why I created courses, I created programs, I created outlines for sports PTs who wanted to work with these individuals, but they were having a hard time. And over the last, I think this is my 5th year in hosting my management of the barbell athlete course, I've created several outlines and several frameworks and easy movement screens to be able to look at some of these individuals. And I'm going to share some tips for you to be able to do that. But just know that these athletes are different. And if you treat them the way you have to other types of athletes, you'll have an empty schedule. You'll have people who just literally and they're pretty direct. They won't fluff it up very much. So the first part is, as I mentioned, they won't stop. They won't. They won't take a break. Now they'll probably decrease the load before they stop the number of training days. And I think it's very important when you start making adjustments to their training. If they train 5 days, try and accommodate those 5 days. They won't stop. Okay. So if you say, hey, let's back you down to 2 days or 3 days, they're not likely to comply with that. So the first thing you have to do, if you understand that they won't stop, you need to adjust how you can then work with them. So if you're saying, hey, I'm going to work with you on trying to get you to train 5 days. Now, what things do you have to adjust accordingly? Well, there's only two main variables, and that's like load and or excuse me, intensity and volume. And you then have to play with, okay, so if not, I'm not changing the amount of days, then you have to play with the intensity. So how much load are they okay with? And they're more okay with dropping how much weight they use versus the number of days they train. The one exception with this is if they are competing in the very near future. That's the one exception that they won't do. They won't decrease the load. If you understand that and you can adjust that with their days of training, they're more likely to stay with you. So the other thing that you have to realize is that even though they have pain, these individuals are not looking for simple pain relief. I know it sounds odd, but they're not looking for ways to solve their knee pain. They're trying to figure out, where did this happen? How do I avoid this in the future? And what do I need to do with my current plan to ensure I stay on the right path? And so, how is that different than most orthopedic or sports approaches? Most sports PTs will go towards the knee. They'll test the knee. It's a medial meniscus, impairments, knee valgus, blah, blah, blah. These people aren't looking for just that. They're looking for, what do I do with the number of days I'm training, which I just outlined? What am I doing with my intensity? What are the modifications that I can do to my lifting? So am I pulling from the ground? Am I pulling from a hang position? Am I doing a partial squat? Am I doing a full squat? Am I doing overhead pressing? What am I not allowed to do? So they're looking for your do's, your don'ts. They're looking for adjustments to volume and intensity. Oh, yeah. And they want to be able to solve the knee pain at the same time. So just know they're not looking for simple pain relief. They're looking for a plan. The third part, so number one, they're not looking to stop. You have to adjust for that. Number two, they're not looking for simple pain relief. They're looking for a plan. And number three, they're not looking for exercises. Now, if you were to go onto YouTube or Instagram, you would think, oh, I'll find the best ankle dorsiflexion exercise, the best hip mobility exercise. The reality is that these individuals are very analytical. They've done their research. They've probably looked on YouTube. They've probably been on Instagram. They've already seen those, and they probably have already tried them. So when they get into the clinic and you're working with them and you pull out your best magical 3 exercises, they're more than likely have tried them. And that's a little frustrating as a clinician, because you realize, wait a minute, my normal arsenal of exercises and approach to this person hasn't worked. I'm trying to prevent you from that feeling, that like sunken feeling of like, well, what do I do next? These people, as I mentioned, they're very analytical. They have researched all forms of exercises. They've tried them on their own. They've been to probably multiple providers. They're more likely, they have that pro athlete mindset. They're willing to do their research. They're willing to see multiple providers. So you might be the 4th, 5th, or 6th medical provider. They might have seen the ortho, they might primary care. They might have seen a chiro, a massage therapist, a physical therapist, an athletic trainer, whoever. And you have to ask, well, then how do you separate yourself as a provider? How are you different than everybody else? And this is the biggest mistake that I see a lot of sports PTs make. They apply what they typically do with athletes to this individual. And it just doesn't work well because like I said, if you're not making a big difference in 3 to 4 visits, you'll find yourself with them self-discharging or an empty schedule. So number one, they won't stop. Number two, they're not looking for simple pain relief. And number three, they're not just looking for exercises. So you're like, well, if they're not looking for those three, that's what every single patient comes to see me for. What they're looking for is the package. They're looking for somebody to put it all together. They want to know, can you, on that initial evaluation, run through a movement screen, figure out exactly the 2 to 3 impairments that are causing their pain, provide the do's and the don'ts with their training. What do they need to adjust on their volume and intensity, number of days, how much, percent of their 1 rep max, and then figure out how long is this going to take for them to get better, or will they be able to compete? And if you take this simple approach to figure out their do's and their don'ts, is their green, yellow, and red lights. So meaning the red lights are, I don't want you going into a full squat because I think that's going to continue to give you the hip pain. Okay, so that's a red light. What's the green light? Well, you can do 50% squats. So you can go halfway down and halfway up. You cannot go all the way down. What's my yellow lights? Well, you can do all those variations at a under 90% of your 1 rep max. Okay, so now they have an outline. How many days can they train? 5. Well, what are their big days? You get 2 days of high intensity, 3 days of low intensity, all at partial ranges. That makes sense. What's exercise you're doing? I'm doing a banded hip exercise. I'm doing a non-weight bearing hip strengthening, and I'm doing a balance drill. I don't know, whatever versions you want. But ultimately, you're packaging this. That way you're attacking their training, which is you're making modifications there. You're giving them expectations on how many days, weeks, or months this is going to take them. And then you're providing them with the do's and the don'ts, the green, yellow, and red lights on the initial evaluation. That's what they're looking for. Most sports PTs, they'll apply. Yes, you may be like, oh, well, I do all those things. Yes, you do, but it might take you 6 to 8 visits to do all those things. Can you do it on the first visit? And a lot of these barbell athletes, whether they're a CrossFitter or a powerlifter or an Olympic weightlifter, because their sport requires so much attention to detail, these people do the same with the providers they look for. They look for that confidence. And whether you've done these barbell movements or not, it's can you provide the outline? Now, if you can do these movements and you've done some form of powerlifting or weightlifting, or you just know how to move under a barbell and you can talk the talk, well, that's just icing on the cake, but not necessary. So if you understand and you've done some form of CrossFitting or Olympic lifting, and you know some of the verbiage, that's great, because now you have a little bit more arsenal to the buy-in. Now you understand their world. And these individuals, more than a lot of the pro athletes I've worked with, even at the community level, they are very similar. And if you are saying, okay, what's the top 1 or 2 things that I can do? I would say ask about their training. And then, it's interesting, they'll probably have some type of video selection on their phone of, of drills they've recently done, or attempts at their 1 rep max, or their training sets. I would ask, do you have any videos of some of the things that you're talking about, or you're having trouble? They will more than likely have a few videos that they've recorded themselves where they've had the pain or whatever it is. So ask them to show you that, and then make adjustments and ask for their training cycle inside of, maybe they might have a Google Sheet, or they might have a spreadsheet of some sort, or something like a training log. You do those 2 things, you gain insight into who they are as a person. And the minute you do that, they realize you're different. If you ask, what are the top 2 things? Look at their training log and look at their form inside any form of video that they're recording. What you've done there is you've actually cared about who they are and what they do, not just the body part that they're experiencing pain. And most providers have gone straight to that. That's every single provider. And it's a way to separate yourself. It's literally how I got started into working with barbell athletes. I've worked with CrossFitters and powerlifters and Olympic lifters at a very elite level, professionals, and at the community level. And they're very, very similar. You treat them exactly the same, and they want to know that you care about what their sport is and how it's different, because they've been to other providers who treated them like a soccer player, were very vague. They went week by week, and these are the things not to do. You go week by week, and you say, "Yeah, let me see you next session. Let's just see how you do. Let's see how it goes." They're not looking for the banded shoulder exercise. They're not looking for the clamshell. They're not looking for the ankle drill that they've already tried and people already provided them with. They're looking for somebody to put that all together, so that way they have a week by week progression for the next 6 to 8 weeks. Can you do that? That's the question. And if you can't do that, and you cannot create the plan or the roadmap, that's where you're going to lose them. That's where you as a provider are going to have a challenge working with these individuals. And that's why I created my Management of the Barbell Athlete CEU course. I had seen so many providers. I was mentoring so many that, they were asking all for the same things, like, "Hey, what would you do differently?" And it wasn't the exercises that made the difference. It was the approach and the outline on how to do them. And one of the biggest challenges that people had was, what movements, if I've never been under a barbell, what movements should I do? What screen should I provide for them? And do I need to have a back squat or a front squat specific movement screen? And that's not the case. What it really comes down to is the fundamentals all packaged underneath doing barbell specific movements. So if somebody has shoulder pain and they have pain with snatching, most people would go towards the shoulder. Let me test the shoulder. Let me see the strength. Let me see the scapular position, blah, 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 the T-spine, blah, blah, blah. When in reality, most of these individuals have problems at the ankles or the hips that wouldn't allow them to get in a full snatch position. And that's why they were having shoulder pain. So that's why most sports PTs were missing it, because they were treating the shoulder when they should have been treating the ankle and the hips. Now, to the athlete, they're like, "Wait, why are you working on my hips?" And you have to go through this biomechanical assessment. Or if somebody's having back pain and they're having back pain with back squatting, and you look at their shoulder external rotation and you fix that and it helps with their back pain, they're like, "Wait a minute, why does my shoulder influence my back pain?" Or if they're having pain with the clean and in their front squat position, you realize that they have a lat length position and their elbows are down when they're in a front squat. So you're telling me that a lat length improvement would help alleviate back pain. These are the instances where you need to understand the mechanics of these individuals is different. And while you might manage the site of pain, you need to be looking above and below that joint. And that's the problem with most sports PTs. They go towards the region, right? Like, you go towards the side of pain, and that's the problem. And ultimately, it comes down to looking at the shoulder, looking at the ankle, and those two primary joints. Everything gets caught in between those two. And as I taught my Management of the Barbell Athlete course, I realized how simple and basic this was. And over the last 5 years, I think it's my 5th year now delivering this course. And every single time I have sports PTs who are like, "Gosh, that's so simple. I can't believe it's the same thing I've been doing, just packaged a little differently." And one of the things I've created is I think it's 3 to 5 minute screen on how to get these athletes to understand where their challenges are, run them through a screen, and identify two impairments that are contributing to their site of pain. Being able to simplify that process and help them understand that, yes, their ankle and their shoulder are the things that are causing their back pain, and helping them understand that, and then realizing how many weeks that was going to take to improve that, and then what are the progressions. So if they have pain with a full snatch, Can they do a power snatch? Can they do a hang power snatch? When can they do a snatch balance? Then progressing them into a full snatch or an overhead squat, and learning these progressions. And over the years, I've realized that you as a sports PT don't have to be an Olympic weightlifter. You don't have to be a CrossFitter. You don't have to be a power lifter. Understand their mindset, have a conversation, and let them know, I've never done these lifts before. However, I do understand mechanics and I can help you with your progressions. Ask them to tell you what a clean looks like. Ask them to show you what a snatch looks like. The minute you can do that, you don't have buy-in, because now you're asking them for more information on their sport. And most sports PTs are so proud, they don't want to show that they don't know what they're talking about, and they want to be the medical professional with the white coat, and I'm a sports physical therapist, and I can work with you athletes. These people just want to know that you care. They appreciate humble, direct, transparent sports PTs. So the thing you can do is be honest with them, ask to see their training, and ultimately realize that they're not like everybody else. The minute you can do this, you put yourself in a position where you now broaden your horizon. Now you can work with several different types of athletes. Barbell athletes, I'm very passionate about working with these individuals. It's a population that I have grown to specialize in. And if you're a sports PT who has no experience, you need to take my management of the barbell athlete CEU course. And if you have worked with these individuals and you're looking to fine tune your experience and your knowledge underneath a barbell or a load, you need to take this course as well. Or I've realized a lot of sports PTs who enjoy working out and training, they use my course for a way to improve their training, their own personal training sessions, and improve their fitness. So if that's for you, that this course is also perfect for you. So nonetheless, if you're a sports PT and you're looking for an opportunity to work with a unique population who has a huge need, CrossFitters, powerlifters, Olympic weightlifters, they are growing in popularity. They're looking for something different. And there's nothing secretive about it. They're just looking for somebody with all the qualities that I just mentioned inside this episode. And ultimately, somebody who can package it all together. And if you feel that you don't have that, or you don't know where to start, my management of the barbell athlete course is a fantastic place to start. I have a live in-person and virtual option. If whenever you're listening to this, my upcoming course is October 28th and 29th, both in San Diego and virtual. It's a great opportunity for you to work underneath a PVC or a barbell and try the movement, see what you're good at. How is your ankle limiting your back pain, or how is your ankle limiting your shoulder range of motion? How is your hip affecting your neck pain? These are all things you'll realize as you move under a barbell quickly, that there are a lot of stressors that go through the body that maybe you were not segmenting or you were not putting together. It's a great way to really understand your patients and your athletes just a little bit better. It is a full 2 days of mechanics and corrective exercises and strategies to give your athletes what they need and a full plan as soon as the initial evaluation, and within, honestly, 3 to 5 minutes of a movement screen. So if that's for you, I'm excited to have you inside my management of the barbell athlete course. And it's honestly a great opportunity for you to grow your toolbox. Most of us have taken, regional courses, where you're working on the hip, the low back, the shoulder, and everything else. But if you're looking for something to put it all together for a specialty sport or a broad range of sports, it's perfect for you. Other than that, I hope that you are doing great and this is helpful inside your clinical practice. And I hope you are absolutely crushing it inside your fitness, your career path, and everything beyond. And I'm excited to see you inside the course. All right. I will see you guys on the next one. Take care.